Consideration of a patient's prostate anatomy as compared to a normal prostate is key to selecting the appropriate procedure to treat the specific condition. Larger glands, up to 100 grams, including more moderate glands, when occurring symmetrically, are indications for treatment with cooled thermotherapy. For smaller glands and complex anatomy, including an asymmetric gland, the presence of a median lobe, with the exception of ball valve, or a prostate with short lobes, Prostiva RF therapy is indicated. Together, the options of cooled thermotherapy and Prostiva RF therapy enable urologists to treat most prostate anatomies in the office.
About 2 years ago, 2 or 3 years ago, I saw a poster that was presented at a meeting that was a preliminary to a paper that ended up in the Journal of Urology, and it convinced me that I should rethink microwave therapy. It was a poster that had 5-year data on cooled thermotherapy, and that right away was interesting to me. At 5 years, the patients were not taking any medications, had not had salvage therapy, and that was something that was important to me. The way I looked at it is I could offer a procedure right here in the office that was easy to do, that had a 70% success rate at 5 years. And for me, that was a home run, that I could offer a patient something that could be done here in the office. They could walk out the door, not have to be kept overnight, and could be successfully treated.
Cooled thermotherapy treats BPH by applying microwave energy to the prostate via the transurethral microwave catheter that precisely heats diseased areas while simultaneously cooling fluid and protecting the pain-sensitive urethral tissue. This method of circulating cooling fluid through the microwave catheter minimizes patient discomfort and risk of thermal damage to the urethra. The cooling of the urethra provides an analgesic effect during the treatment while maintaining the urethral temperature at less than 45 degrees Celsius. This effect allows the treatment to be performed in the physician's office without the need for general anesthesia. Continuous energy delivery allows for a durable and consistent treatment for many men with symptomatic and/or obstructive BPH. The preservation of urethral integrity is a unique feature of cooled thermotherapy that defines it as a minimally invasive treatment and limits morbidity.
They see it as a way to get off a daily medication, and with the fact that we can treat the patients here in the office with very little complication and with very, very good success, they can look at a 5-year data like I can. I sit down with them and show them the data and say at 5 years you could be going with no medications, no surgery, no complications. And that's really a very attractive factor for patients.
Any urologist that's done a number of TURPs will understand how to do the Prostiva very quickly. We all know how to resect tissue, what may be offending the water channel with occlusive tissue of the prostate, and how to resect it. In my experience, those areas that could be resected are easy to take care of with the Prostiva.
Prostiva RF therapy treats BPH utilizing low-level radiofrequency to destroy enlarged prostate tissue. The movement of the electrons causes the tissue to heat. One reason RF energy has been so effective in forming precise and controlled lesions is the existence of a phenomenon called current density. Current density is the amount of current flowing out of the surface area of the conductor. As the current is emitted from the needles, the energy is concentrated along the small exposed surfaces of the needles, creating a very high current density at the needle surface. The energy quickly dissipates as it leaves the needles on its path to the grounding pad. This produces predictable and repeatable lesions, which are located directly around the needles.
The Prostivas have been much more effective than I could have hoped for. 6 weeks to 3 months after the procedure, I'll ask patients, are they glad they had this done? And if they had a friend with similar symptoms, would they refer them for Prostiva? If they tell me yes, I put them on what I call my happy list. Over 95% of my Prostiva patients make it to the happy list, and I think that's a big number.